Assalamu alaikum. Today we're going to talk about stroke. Stroke is one of the leading cases of morbidity and mortality worldwide. WHO statistics indicate that all types of stroke ranked causes of death between 13 and 15%. As the third and surpassed only by heart disease and cancer. Each year, 15 million persons suffer from stroke worldwide, out of which 5 million end up with mortality and the remaining 10 million have been deeply disabled. Each year, Mongolia registered 270 to 290 100 cases of stroke in 100,000 populations. Thereby belong to countries with higher incidence of stroke. What is a stroke? Blood vessels that carry blood to the brain from the heart are called arteries. The brain needs a constant supply of blood, which carry the oxygen and nutrients it needs to function. Specific arteries supply blood to specific areas of the brain. A stroke occurs when one of these arteries to the brain is either blocked or burst. As a result, part of the brain does not get the blood it needs, so it starts to die.
In the Western industrialized countries, age-adjusted stroke incidence rates range between 100 to 300 per 100,000 people per year. Every year in the United States, about 700,000 people of all ages suffer a new or repeat stroke. Approximately 158,000 of these people will die, making stroke the third leading cause of death in the United States. Each year, Mongolia registered 1,700 to 290 cases of stroke in 100,000 population. Therapy indicated that Mongolia has high rates of stroke incidence as compared with the average stroke incidence rate in the world. In the developed country, cerebral infarction account for 87% of all stroke types. In Mongolia, the ratio of brain
Management of ischemic stroke. Cerebral ischemia is caused by blockage vascular supply in the local region of the brain, except during the general circulatory failure due the cardiac to arrest and systemic hypotension. Occlusion of the cerebral artery typically results in an area, the core, so severely ischemic that will be damaged irreversibly within minute or hour, surrounded by a less ischemic penumbra of neuronal tissue that may be temporarily inactivated.
Causes of cerebral infarcts are extraintracranial large artery disease, cardiomyolism, small artery disease.
The typical of ischemic stroke, embolic stroke, lacunar, hemodynamic, transient ischemic attack, reversible ischemic neurological defect, cerebral infarctions.
Evaluation and management of acute stroke. Any patient suspect of having a stroke should be transferred as quickly and safely as possible to the nearest hospital with staff experienced in the acute stroke management and emergency brain imaging. The emergency aid to the stroke patients can be taken in a short time in following orders. Transportation to the hospital with a stroke unit. Pre-hospital recognition stroke symptoms. Evaluation of general condition and neurological station of patient in stroke unit. Immediate clinical and neuroimaging diagnosis. Immediate starting of general and specific appropriate.
Diagnosis of stroke 1. Brain image CT or MRI 2. ECG 3. Laboratory tests. like INR and PTT.
Of ischemic stroke, general stroke treatment. The term general treatment refers to the treatment strategies aimed at stabilizing the critically ill patient in order to control systematic problems that may impair stroke recovery. The management of such problems is central part of stroke treatment. General treatment includes respiratory and cardiac care, fluid and metabolic management, blood pressure control, the prevention and treatment of conditions such as psoriasis, venous thermoembolism, diaphagus, aspiration, and pneumonia. Other infection or pressure, electronitation, and sectionally management of elevated intracranial pressure. It is a common practice to actively manage neurological state and vital physiological function, such as blood pressure, pulse oxygen, saturation, blood glucose, and temperature. Neurological state can be monitored using validated neurological skills such as the NIH stroke skill or the Scandinavian stroke skill cells. There is little direct evidence from randomized clinic trials to indicate how intensively monitoring should be carried out, but in stroke unit trials it was common practice to have minimum of 4-hourly observation for the first 72 hours after stroke. Close monitoring is also required for the first 24 hours after thrombolysis. More emphasis monitoring procedures such as central venous catheter or intracranial pressure monitoring are used only in highly selected patient groups.